Thank you. Thank you for having me here. I am from California. I know all my training has been in California, but I actually spent time on the East Coast in Baltimore. I lived for 4 years and then did a research fellowship with Cornell when I was in undergrad. So thank you for coming. So I want to thank you up front, obviously, for inviting me, but also for who you are as Mount Sinai Medical School. Let me tell you, from California, you all have a reputation for taking social justice issues head on. Does that sound familiar? Okay, not just on the website or... so I thank you. Actually, we were having a session with a Dr. Boatwright from Yale, who just published an article last year on AOA and how it is discriminatory racially. And he told us that you were one of the few medical schools that does not have an AOA chapter. Is that right? So you're an amazing company, and well, just thank you for who you are. All right, so for today, just going to talk a little bit about issues of race, power, and identity that can affect the work we do, delivering healthcare, and also with one another. And make visible often unspoken social scripts we hold for the other and sometimes for ourselves that can impact our encounters, hoping that if we can see the script, we're not going to perform it if we need to interrupt it. All right? And if there's one skill I would hope you would get out of that, it's to make visible the scripts that put us in situations where you don't want to be and you wonder, how did I get here? How did I get here again? So, and then just outline some components of cultural humility. All right. Of course, I got to give you a quiz, because that's what we do in the profession of medicine. Not standardized, though. So I'm a little sarcastic, and I try to be a little funny, so I'm going to ask you to kind of wiggle your shoulders and loosen up a little bit. It's not going to go well if it's not back and forth for me, okay? Everybody good? Okay. It's a different way of learning. I don't have a lot of references that I'm going to go through. They're all on the slides, but I'm kind of a visual person, so take off your uber academic hats and let's start with the quiz. So I want you to guess this community, if you would. Members of this minority community were brought to this country as slaves. Many remain at the bottom of the social and economic ladder today, and they do the dirty work when they have work. The other members of this community think members of this minority are intellectually inferior, if not stupid, and discrimination against them in the areas of housing, employment, and education is not unusual. Over the years, tensions between minority and majority have broken out in deadly riots. In the past, minority children in this community were forced to attend segregated, underfunded schools, and many did poorly in school. Today, in this community, schools with a high concentration of this minority's children have high dropout rates. Many majority parents move out of the school district or send their own children to private schools. Children from this minority community are disproportionately in trouble with the law. And not unexpectedly, children from this community do worse on standardized tests than majority children do. Any guesses? Remember, you're loosening up your shoulder, no wrong answers. Any guesses about what community this is? Not gonna hurt my feelings. So funny when I'm in a group of physicians, and you know, it's like once a pre-med, always a pre-med. So you're like, 1 + 1 is 2, and you're like, I know the answer is 2, but I just can't risk it. Go ahead, sir.
I have a suspicion it's a trick question, but when I read this, I hear the black community.
Black community, okay. Why do you think it's a trick question? It's like A and B? Yeah. Right, A and B, all the above, none of the above. I know. So the black community, any other guesses? All righty. Sometimes people guess the Native American community in the United States, although, of course, they were not brought here as slaves. This is their land originally, but we are starting to find out about how extensive enslavement of Native Americans was. There's a book called The Other Slavery by Andreas Resendez at UC Davis, award-winning book about, again, how much we don't know about slavery of Native American folks in North America. So, but that's not this group. The answer is Koreans in Japan. Got one. That's what I did when I read this in a book called Inequality by Design.
Now I must have been more paranoid.
Yeah. I don't think there are any more questions on here, so I think you're okay. I think you're okay, Dave. No, it was a reasonable choice, right? What's the next thing? What's the one next thing you would do, right? There's only one thing in clinical medicine, so silly how we confine our knowledge to that. So Koreans in Japan. So there's a group of Koreans who live in Japan called the Zainichi Koreans. And they were Korean nationals who were enslaved during World War II by Japan. And they worked making munitions. They worked as soldiers. They worked as so-called comfort wives in Japan. And when World War II was over, most Koreans went back to Korea, but some stayed. And those are the Zainichi Koreans who, for all the world, look like the so-called minority African Americans here in the United States. So this took me off my base a little bit, just a little bit off my foundation, because, wow, I thought it was African Americans. And again, even though I have a public health degree, we are so used to identifying a group that we need to fix, that we need to teach to behave like we do, right? Hopefully we know the talk about systemic issues and ecological issues, but for the most part, when we see a disadvantaged population, we run to them, right? If we see an underserved population, that's what we're going to problematize, right? That's what we're going to help. Hello? Rarely do we think of, and I know you do at Mount Sinai, the whole that we are all part of. So if there's a disadvantaged population, does that mean there's an advantaged population? If there's a privileged group, does that underprivileged group, does that mean there's a privileged group that we need to problematize as well? We don't often do that, right? And we don't often think about how we do America together. And how this was an amazing example to me, because that's the Zainichi today. That's not the Zainichi back in World War II. Somehow, intergenerationally, this order, or what I call a script, was reproduced. And that's what I want you to think about today. How does that happen? How does that happen? So what's a script? You all are in New York. Tried to get my family to come so we could go see Hamilton. Didn't get any takers. What's a script? Where do you see a script? Again. Don't die. I know you're not going to answer, David. Peter, sorry. Where do you see a script? Where do we use a script?
TV shows?
TV shows. All right, right on. Okay, where else? Movies, plays. In the theater, right? What do we use a script for? Tell a story. Okay. What else? Portray a character, so you know your role. It's not hard. It's not calculus. What do we use a script for? To know what to say. Here we go. To know what to say, to know what your role is, to know your relationship to other people on that stage, to know where to stand, to know how to dress. Y'all getting my analogy here, my metaphor? I think the most important aspect of a script, though, is that there's going to be an outcome that's predictable, right? So I don't spend thousands of dollars to see Miranda's Hamilton and end up going to see Medea's I Can Do Bad All by Myself, right? That was a joke. That's the best one, too. That is the best one of the morning. Okay. So, right? So there's a predictable outcome. So I'm walking back over 3 decades thinking, wow, when my children are looking for places for community service, they're going to know exactly where to go in Sacramento. Is that true? In New York City, in Manhattan? It's almost like it reproduces itself, right? Our relationship to one another, who's going to score well on tests, who's going to be in our medical schools, who's going to be in our faculty. Pretty rigid outcomes that are predictable. How do we do that with such fidelity? I love, in terms of our relationship to equity and health equity, to think about the scripts that we perform institutionally, professionally, personally. Sometimes you get pulled into scripts that your patients have for you. Anybody ever been pulled into a performance of distrust before they realized what was going on? You didn't think you were playing the role of the one who was distrusted, but you got pulled into it? And how all of a sudden somebody's calling you a racist and you're like, wow, that is not what I intended. That's not how I roll. Has that ever happened to you? No one. No one's ever been called a racist. Every day, right? So predictable, right? We have issues. Our profession has issues. Hello? Social work, issues. Hello? All right, so script is metaphors from transactional psychology, kind of games people play, etc. That's one source that really informed my thinking on this. I think the script works well because it makes visible scripts that lead to predictable outcomes with incredible intergenerational fidelity. How do you interrupt that so we get a different outcome next generation? It goes beyond self-awareness, like you've probably been to dozens of trainings where somebody tells you have stereotypes and biases, right? I know, Jann. I know. I got it. This, if you can identify a script, it leads you to the action of interrupting it. Okay? Some developmental goals in terms of how you recognize scripts. Who's going to tell you that you have scripts that are dysfunctional? Who in your professional, personal circles are going to give you new scripts for people maybe you didn't grow up with? Scripts allow you to avoid the accusation that the curriculum is anti-white, right? So I told you about Koreans in Japan. I could have told you about Tutsis and Hutus. I could have told you about Germans and Jewish folks. Could have told you about African Americans in their relationship in the United States. So it takes it out of that we're blaming one group and one group only has the issue. We're all performers in this script, this ongoing performance we call America. We internalize scripts. We play scripts on other people. People play scripts on us. All of a sudden you're performing something that you had never intended to perform. Scripts avoid stigmatizing groups, like I said, at the bottom, as not having tried hard enough. And it's hard for us in the helping professions, right? Because we want to help. We want to help, and we got to identify groups that need our help. Hello? Right? So that takes, it takes us from that, we're helpers. People are receiving our great beneficence to, how do I fit into all this? Perpetuation of a national social script that is New York, municipally. I remember listening to this man. I can't remember where it was, but it was an African American in New York City. Young man, he said during the stop and frisk which has its script, right? Not just black men are criminals, but we get to do this. This is good policing. Said he'd been stopped 200 times. He'd been stopped in a really nice car. He'd been stopped in not so nice car. The script didn't change for him. And this is not a left-leaning or right-leaning political ideology. That's why I like it. So let's talk about the dynamic script of race in America. I bet you all know this, but when I talk to groups, I have to really make sure people know the difference between race and ethnicity. And there's no gold standard, but can we talk about race in this room today? All right, so on the right is a study from Stanford. They just took these iPods and placed them in two different people's hands and saw what happened when they put it on eBay or Craigslist or whatever. We got a script, right? Already. You probably know what's going to happen. Statistically different prices people offered to pay, fewer offers for the dark-skinned person. People were less willing to give their names and their addresses. People didn't want to give credit card information for the darker hand. Now I want you to look. You don't see any single mothers there, right? You don't see any missing fathers. You don't see pants without belts. Hello? You don't see that neighborhood. We just know things about people based on what they look like, right? Deep within our souls. I don't care who you are. You may be good at interrupting those scripts, but if you were born in America, if you were raised in America, you have this script. Okay, Dr. Takaki wrote one of my favorite books that got me started on all this called A Different Mirror, Multicultural History of America. I can't recommend it more highly. Short chapters on many different groups, including Filipinos, Jewish folks who came during the turn of the century, how people came to this country and were not American when they got here. Some of whom are not necessarily American now, unless we get to ask a couple of questions. We have scripts for people. Dr. Takaki was traveling to a multicultural curriculum conference in Virginia, and he was in a conversation with the taxi cab driver when a familiar question came. Hey, how long have you been in America? So Dr. Takaki, having faced that question before, said, what was the truth? That his ancestors had been here for over 100 years. He's Japanese American. His ancestors worked on the plantations in Hawaii. And the taxi cab driver goes, because your English is excellent. Race is like that. We think we know something about somebody as soon as they walk in the door, subconsciously. Okay? This book, How the Irish Became White, I'm going to look at my time because I get talking. And the Irish were not white when they got here. The colonial British people needed some more white people in the mid-1770s because there were so many Native Americans and Africans they had brought here by that time. So they had to make it up. When I read this in Takaki's book, it changed my life because I'm like, wait, what? Race is made up? White is made up? So it was just the British who were white at that time, and they're looking for more white people, only so many British there. Somebody said, well, what about the Irish? And Benjamin Franklin said in his writings, no, not the Irish. Right? In the British mind, they were savages. Hello? Stupid? They had scripts for them, right? They couldn't be white. We're white. They're not white. See how silly it is? But powerful. Right? Somebody said, well, what about the Germans? He said, well, okay, here's the thing about the Germans. See, where I live in Pennsylvania, Ben Franklin talking, they want to make Pennsylvania Germantown. They want everybody to speak German. They even want bilingual education. Is that familiar script to you from today? So here we are. Who stole this island from the Manhattan nation? Don't know that criminal history. The Dutch. Right. It's called New Amsterdam, City of Commerce. Ben Franklin said, no, okay, not the Dutch. Not the Dutch. See, they come here and they work for such low wages, they make it hard for those of us who are British to make a living. Do you hear those scripts echoing throughout hundreds of years of our history? So there are historical scripts. The law of 1790, naturalization law of 1790. Hello? Hello, Peter? Yeah. Okay. All of the above? Okay. Not going to ask you. It made all people white. All men who were white were made white. Hello? Because they had to make up some more white. They had to create more white people. And so I'm like a 20-something-year-old reading Dr. Takaki's book going, well, wait a minute. If they made it up, can't we unmake it? It's a powerful thing, race, how dynamic it's been. Of course, many of you know that in the 20th century, that changed again, right? So the people from Eastern Europe were not white. How many folks we have? Greek, Portuguese, Slavic, Jewish folks, not white until they became white. And some folks would say the Jewish folks haven't become white. So race is about superficial characteristics that we subconsciously believe tell us something about the essence or potential of a person. When do we learn these scripts?
We brought together 3 groups of kids at this day camp and showed them pictures of 2 men, one Arab, the other Asian.
Who do you like better, this man or this man?
The Chinese guy.
Over and over, they said they liked the Asian man more than the Arab.
He looks meaner and he looks nicer. Because he looks nicer? Yeah, he does look nicer. And he has a smile on.
But both men are smiling. And what did the kids think about the personalities of the men?
Let me ask, you don't know this person, but what do you think he's like?
I think he's weird.
Why is he weird?
He just doesn't look like a very nice person, no. He looks like a scary dude.
He's on the phone. What's he talking about?
Maybe a robbery?
Then I ask about the Asian man.
What's he like?
He looks like a regular teenager to me.
We then showed them pictures of a black man and a white man. What were some comments about the black man?
He looks mean. FBI most wanted. He looks weird. He looks like he's a basketball player.
So, tell me about this guy. Does he seem like a nice person?
I think he's nice. I think he's nice, except he might be mad about something.
He was probably picking up on something. This is Oklahoma City bomber Timothy McVeigh. But when we ask which man is a criminal, most kids pointed to the black man. And when we asked which was a teacher, they said,
That one! The guy in the green shirt.
So if you had to believe the kids, what career choices did they have for the black man? Let's go with him. What career choices? Criminal, FBI's most wanted?
Basketball player.
Professional athlete. They're not 10. That's frightening to me. How did they know about the script of mass incarceration? How did they know that? Some people would say, oh, that's from their parents. I bet you these parents would be horrified. I think, my friends, it's in the air or the water. I just don't know. But I almost think it's a spiritual kind of thing that we learn who the other is very early in our lives. You know that the phenomenon of racially disproportionate suspension is the precursor to racially disproportionate incarceration. You know that African American preschoolers make up about 18% of preschoolers from the U.S. Department of Justice, 48% of preschoolers who are suspended. I know some of you, why are we suspending preschoolers? But that's incredible that early we're picking out kids who are problems. Hello? Yes, sir, Peter.
This is partially defensive, but what community, do we know what community those kids are?
No.
And it looked like a pretty, I didn't see any black kids in there.
There were some mixed kids.
I saw some Asian kids or Indian.
Yeah, so I'm going to say that every community in this country has disproportionate suspension rates. So I'm going to say, and has disproportionate, you name it. So I'm going to say that it didn't matter what color the kids were. I could show you doll experiments where the black kids thought the white kids would make better friends, were the smartest kids. Anybody seen Anderson Cooper's work on kids and race, young kids and race? So let me tell you before we go on that the Zainichi Koreans are disproportionately professional athletes and professional entertainers. Hello? Maybe not the black folks. Maybe it's something we're doing together, reproducing together. Race is something our chromosomes do to us. Race is not something our chromosomes do to us. Race is something we do to each other. So important in this era of genomics. Please don't run down that path of trying, when the human genome was first sequenced in 1992, Bill Clinton introduced Francis Collins. And so Bill Clinton said this should settle the question of race. We're 99.5% alike genetically. Today, it's 99.9% as we worked with the human genome. Do you know there are people who've made their careers out of detailing that 0.5%, 0.1%, and trying to explain health disparities based on that? Or even incarceration rates? Or intelligence? Race is not something our chromosomes do to us. Race is something we do to each other. So I like this. I hate quoting a UC Berkeley geneticist because I'm from Stanford. I don't know if you all know that rivalry. That's why I spell Berkeley incorrectly. It's been about 10 years that's been up there, never changed it. Oh, how did that get in there? Sorry. How did that get in there? All right. What about a script of invisibility? Native American folks? Do we still have them? Are there still Manhattan people? Are there still Shinnecock folks? You know that Native Americans, according to the CDC, are proportionately more likely to be shot unarmed by the police than black folks? Those are the data. Invisible. Native Americans. Scripts we hold for African Americans: criminal, threat to public safety, inferior intelligence, normal behavior is pathologized. Hello? They don't do it like us, so less sentient and reflective, meaning they don't feel the same type of pain or the same degree of pain. I know all of us are like, oh, I'm so glad I don't do that. So here's a bunch of pictures. I'm not going to go through all of them because I'm going to get the 10-minute sign, I think. Yeah, in 6 minutes or something like that. So do you know these? Do you know these? What's up there? Starbucks, Pennsylvania, really wealthy black women playing golf. We're told they had to leave because they weren't going fast enough. The people behind them, the white people behind them said, wait a minute, we never caught up with them. How can you say they're not going fast enough? Black woman, obstetrician gynecologist on an airplane. Heard about that? Is there a doctor in the house? She gets up. Stewardess says, no, sweetie, we mean a real doctor. Don't have that script for black women. I wish I had more time. I'd tell you about the 1990s when I was at Oakland Children's Hospital, how often that happened. Yale grad student, sleeping in her own dorm in the common room. Anybody ever fall asleep in the lounge of your dorm? Somebody called the police on her. Just last week, fathering while black, here I think, right? Black man walking his black man walking his baby in a stroller. Somebody calls the police in a park. Threat to public safety. These, I know sometimes people say, well, I'm glad that's not me. Joe Betancourt calls this the not me syndrome. So if you are the one or two people I've ever met in my life that don't have issues like this, thank you. But your colleagues do, your patients do, the people who interact with your patients do. So if you could hang in there with me. Do you remember this from 2 weeks ago? 10-year-old with a backpack. Backpack brushes up against a woman. The woman calls the police to say, 10-year-old goosed me. I want him arrested now. Black folks, think about Emmett Till. That script is still with us. This is about us. Racial disparities in pain management. This is from 2015. JAMA Pediatrics. Some other references there. Appendicitis confirmed. Pathology confirmed. They looked back 2010 to 2013, about 800,000 kids, 0 to 21. When they controlled for insurance, age, gender, you name it, black children were less likely to get any pain medicine than white children. Of course, they controlled for pain score. So for a pain score of 8, this wasn't about, oh, well, they express their pain differently or healthcare providers assess their pain differently. For all the kids who said my pain is an 8, severe pain on a scale of 10, African American children, black children were less likely to get narcotics than white children. It's us too, right? So nobody would say they do that, but as a workforce, we have issues. We know this not just in pediatrics, we know this is in oncology, ER pain medicine for adults. Hello? Low back pain. Where's that script from? Very, very quickly. Blacks feel less pain and have less sensitive nerve endings. That's what residents and medical students said. 2016, I think it was. Proceedings of the National Academy of Sciences, a significant portion said that. Another study by 10 years old, 7 years it was a trend, but by 10 years old, white children said that black children feel less pain for the same incident, falling off a bike, scraping their knee. And then in general, black folks feel less hardship over things like poverty. It's not bugging them that much. That's why we can kind of let it ride. This is a script from hundreds of years old. Thomas Jefferson wrote, their griefs are transient, griefs that we give them. Those numberless afflictions are less felt and sooner forgotten with them. They don't feel the same pain. They don't have a capacity for self-reflection. They don't remember what we do to them. Joy DeGruy would say, isn't that convenient? We convince people of that script, too. We taught that script. All right, so cultural humility as a way to interrupt that script, those scripts we hold for people. I'm assuming I hold them in myself. I want to tell you a story. It's going to take 90 seconds. I was at Target. Do y'all have Targets here? Okay, I was at, no.
116th Street.
116th Street. We have, okay, so I'm there around the winter holidays, got all my shopping done, turkey's done in the refrigerator. I'm at Target. I'm walking. Group of young people walks by. I get distracted. It's just like they're so rude. I can't believe they just walked in front of me. I look up. There's a black man, beautiful man with a beard, not tall. I clutch my purse. Are you serious, Jann? And I go, and I'm like, maybe he didn't see me. And I look up, and he looks at me and just goes, and I go, you know how black folks always talk to each other. Hey. I look up, and he just goes, my boy just turned 18. Black. Half Mexican, but black. Hello? He might go away to college. Wants to come to Berkeley School of Music in Boston. That'll happen to him probably every day. I did that. So you can't tell me that you don't do that. I gave birth to a black person. My father and mother are black people. You cannot tell me you don't have issues like this. Cultural humility versus competence. So if anybody was going to be competent in black people, it would be me. I got all the books you should give your preschoolers. I got all the movies you should have seen. Hopefully you saw Hidden Figures. Hopefully you saw Black Panther. Clearly not everyone has seen that. I got all that. I cannot say I'm competent in black people, so you cannot either. I don't care how long you spent in Central America, you are not bicultural. Hello? We all have issues. We will have them every day if we were born in the United States. Ongoing learning, lifelong learning. We're not going to get there. Maybe our great-grandchildren, if we're not back in slavery the way things are going, will not have these issues. But we have these issues. All you older folks like me, 55 and above, you grew up in a segregated society. I don't see how. We have to keep learning. Redressing power imbalances in the patient-clinician, educator-student. So let's talk about that. So this, my friend, my psychiatry friend will recognize this. It's an amazing book you should all read together in a book club. Actually, the introduction is all you need, by Jonathan Metzl, who's at Pitt, I think. He went back and he was doing Prozac on the Couch, which is a bestseller, but what he was seeing was all these black folks who were diagnosed with schizophrenia, but after 1968. Before this, schizophrenia was a disease of kind of the quirky white male, beautiful mind, and believe it or not, white housewives who just did not like housework. Imbalanced. After 1968, it's the only disparity I know with a date. Black folks are much more likely to be diagnosed with schizophrenia, maybe 4 times as likely, depending on where you are. So we know where this began with some psychiatrists who probably got tenure for this article in the Archives of General Psychiatry, 1968. Describes schizophrenia as a protest psychosis whereby black men developed hostile and aggressive feelings and delusional anti-whiteness after listening to the words of Malcolm X, joining the black Muslims, or aligning with groups that preached militant resistance to white society, pathologizing normal behavior. According to the authors, the men required psychiatric treatment because their symptoms threatened not only their own sanity, but the social order of white America. That's the power difference I want to talk about here. You have incredible power over people's lives. But these people were bothered by how it unsettled them. And that's why they gave these black men that diagnosis. Hello? Not because of what they were doing, but because it upset my sense of order. Hello? Be careful when you get that feeling that things aren't going well and it's their fault. They argue that black men who espoused African or Islamic ideologies, adopted Islamic names, were changed in such a way, their names were changed in such a way to deny the previous English aspects of their name, in fact demonstrated a delusional anti-whiteness that manifests as paranoid projections of the Negroes to the Caucasian group. DSM-2, no kidding. Hello? Understand the power you have over people's lives. Developing mutually beneficial, non-paternalistic clinical and advocacy partnerships with communities. So we have the Hmong in the United States who came from a number of different countries, but mostly refugee camps in Thailand. The Hmong were, I should always have this map. The Hmong are mountain people. We know this well because most of them live in California or Minnesota. The Hmong are mountain people. They are never conquered people. Whenever China or somebody else tried to incorporate them, they just moved to the next mountain. However, the Ho Chi Minh Trail came through one of the mountains in Laos during the Vietnam War. Laos, North Vietnam, South Vietnam. Instead of a not surprise attack through the north of South Vietnam, you could go through the mountains and get to South Vietnam this way. This is the first covert war leveled by the United States, run by the CIA. We were not supposed to be there. But we convinced the Hmong that if they fought for us and interrupted that pathway of the Viet Cong, they would be war heroes. Have you ever heard that? They would be war heroes. They'd get a pension. They'd come to the United States and get all this farmland. Don't worry. We don't know what folks have done for us. We made their country, we made their land in the mountains uninhabitable for us. For us. This is Ann Fadiman's book, if you haven't read it. It's just amazing. This is from her 15th anniversary copy. Merced is a Central Valley farm community where the Hmong congregated in terms of living. Fresno and Merced were two of the. So they're saying, here's this Hmong man saying, here in Merced, you might see Hmong men on the street who look like drunks. Mental illness, just not keeping up with life. What's that about? They don't dress up correctly. They don't walk nicely, but they are not drunks. These are the heroes who saved American lives and got wounded. We don't know what people have contributed to our lives as Americans. We're not curious about that. You would see that patient differently if they came in that way, right? Sometimes we lost 100 lives to rescue one downed American pilot, or just to get back the carcass. If you haven't seen Hidden Figures, there's a million movies I could tell you about. If you haven't seen Cesar Chavez, that movie with Michael Pena, if you haven't seen the recent documentary on Dolores Huerta, I could go on and on. You'll think differently about folks if you sustain that. Your organizations have to do these three things as well. Self-reflection, reducing power imbalances between you and the community, you and the people who are right here. I bet you your trainees are much more diverse than you are, if you're like other medical schools in the country. And of course, we have something called community benefits policy in California where hospitals retain their nonprofit status by giving to the community, which means in our case, you do a focus group and have some chips and salsa. Is that what this means to you? Do you just go out in the community for research subjects? Do you ask community members to teach your residents or medical students and not reward them, pay them like you're paid? Hello? I'm going to end there, and hopefully we have a few minutes for questions. Thank you so much. That's where I want to end. So I hope that you are not leaving here hopeless and like another one of those diversity trainings where you're like, dang, I'm terrible. Nothing's ever going to change. That has not been my experience. That's disrespectful to all the elders of all the races and ethnicities who've gotten us to the place where we could be in a room like this. It wasn't possible 30, 40, 50 years. So I hope this kind of stimulates you to think about what are the scripts that I have for this person or that person.